Unit 12, Stress, Trauma and Psychopathology. 12.2 Introduction. Stress is a very commonly used term, and all of us experience stress in our daily life to various extent. So it can be considered a normal part of our life. When and how does it become a matter of concern that it can create a mental health condition for the individual and needs to be treated as a disorder? Stress in its severe form can create trauma for the individual. It may be noted here that all stressors or factors that cause stress are not traumatic, but all type of trauma can develop stress. Trauma can occur at any development phase of life and even in the womb stage also. The impact of stress and trauma can play a major role in psychosocial emotional development of an individual, which affects behavior and personality of the individual and may cause behavioral, personality-related or other psychological problems / disorders. On the other hand, some traumas are circumstantial and situational and cause anxiety, depression and suicide. It can also lead to psychological disorders such as post-traumatic stress disorder, PTSD. In the present unit, you will learn about stress, trauma, and the resulting psychological disorders. Further, you will know about the management of trauma and stress-related disorders. 12.3 Concept of stress. Any change which distracts individual from routine life or work and causes physical, emotional or psychological strain, brings excitement or depression in any form is stress. Stress is also experienced when something sudden or unexpected happens to someone, when he/she is not prepared for the same, and it is beyond the control of the person. It is body's response to anything that requires attention or action. Sometimes it creates helplessness in the person and the person remains in the condition of stress / tension. The person is not able to deal with the demands of the situation with the existing resources. Thus there is a gap between the available coping resources that the person has and the situational requirements. According to National Center for Complementary and Integrative Health, stress is a physical and emotional reaction that people experience as they encounter changes in life. Stress is a normal feeling. However, long-term stress may contribute to or worsen a range of physical health problems including digestive disorders, headaches, sleep disorders, and other symptoms. Stress may worsen asthma and has been linked to depression, anxiety, and other mental illnesses. Any stimulus, internal or external, or event, which causes stress, or is the source of stress, is known as stressor. A stressor disturbs the equilibrium of body and mind of an individual, and if it persists for a longer time, or if the stressor is regularly affecting the individual, even in small intensity, it may bring negative changes to one's physical and mental health. These signs of stress include physiological changes like rapid heartbeat, changes in blood pressure, chest tightness, increased pulse rate, changes in hormonal secretion, etc. There are also physical changes like muscular rigidity and pain, headaches, body ache, migraines, back pain, stomach pains, or weight gain. There are also psychological signs and symptoms related to stress. Psychological changes include irritability, moodiness, crying, sad, lack of interest, lack of concentration, etc. It increases our emotional responses and hampers our ability to think and plan. During stress, the person may also develop trouble in sleeping, angry outbursts or aggressive behavior, overwhelming guilt or shame, easily startled or frightened, always being on guard for danger. The person may also start to use drugs and alcohol, or start binging on food, internet, and TV watching. The Hungarian endocrinologist Hans Selye, who worked at the University of Montreal, is credited for coining the term stress in 1936 and has done extensive research on stress. In fact, Selye is called as the father of stress research, Sully found that the body reacts similarly to a variety of stressors including heat, cold, pain, noise, and hard work. He explained this in terms of the General Adaptation Syndrome, GAS. The GAS consists of 3 stages. Alarm stage. It is the stage marked by activation of sympathetic nervous system including physiological responses such as increased heart rate, blood pressure etc. Resistance stage. Here the individual tries to resist the stress and adjusts to it by gathering the body's energy resources and mechanisms to fight it. Exhaustion stage. The body is not able to fight anymore, and the resources get exhausted. This may result in breakdown of the individual and feeling stressed. Types of stress. Stress can be of different types in terms of the nature, intensity and duration of stresses. For instance, when there is death of a loved one, or sudden loss of job, or accident, the resultant stress is sudden and intense. It is called acute stress, which is very intense but does not last very long. On the other hand, there are episodic acute stress, which are acute but also episodic in nature, that is, they come from time to time and are repeated. For instance, office-related stress that comes repeatedly with the amount of work that gets added up from time to time. In some other instances, stress may continue for a longer period of time, which is called chronic stress, like stress arising out of marital relationship problems, chronic health issues etc. Miss Alka was about to get married after a week. Everyone in family was busy in preparation, enjoying, overworked, not able to get proper sleep, specifically bride's parent and bride. Suddenly 1 week prior to marriage they got the news that the groom has lost his life in a car accident. Everyone was in shock. But Alka started laughing. She ran and wore her marital costume. After 2 days she slept for 12 to 14 hours, and as she woke up she started behaving as if nothing has happened. She asked everyone what has happened. Why everyone is looking so sad. She totally forgot that her marriage was to happen and now it has been cancelled. This is an example of Miss Alka going through acute stress reaction. Further, we have positive and negative stress depending on the nature of stress. Positive stress or eustress. Positive stress is caused by occurrence of positive stresses in one's life. It refers to positive circumstances and situations, or events in one's life like marriage of close family members or self, promotion in job, any social, professional, family or personal gains like winning a lottery etc., which might create stressful feelings. Positive stresses are linked with happy and positive circumstances / events, energize the individual, cause motivation and excitement in a person's life. However, they may also cause physical or mental problems / illness, by disturbing the equilibrium of body and mind, and may result in disturbances like change in sleep and appetite, digestive problems, hyperarousal etc. If a person is not able to handle the eustress effectively, it may disturb the daily regular life and emotional regulation of the individual. Negative stress or distress, any stimulus or event, which causes negative stress is called negative stressor. Negative stresses are those stresses, which occur due to negative experiences in one's life. It may be very small or simple, like getting stuck in traffic when you are getting late for an important meeting in work or class in college. Or it may be severe like, loss of a loved person or object, sudden loss in financial / social / personal status, divorce or breakup, being physically, emotionally or sexually abused, natural disasters etc. The mild negative stresses may cause physical problems like headache, problem in digestion or mild anxiety etc. But the negative stresses, which have severe impact, may lead towards trauma. Trauma may be sudden like natural disaster, accident or sudden severe illness, death of a close person, or it may be long-lasting, for example, being victim of physical or sexual violence, lifetime diseases or disorders, etc. Let us now understand how psychological stress is associated with psychopathology. Psychological stress and psychopathology. Psychological stress occurs when we cannot control things that happen to us. It indicates a state of helplessness where things do not happen as per our desires, expectations and abilities. For instance, a natural disaster of flood might wash away your paddy field, and leave you stressed, which is normal, but it will not devastate you and lead to stress disorder if you have the resources to build it again. Or you failed to get through a job interview which you needed very much. You are dejected, but your psychological resources help you to cope with it. Similarly, when you moved to a new city for your education or job, you had to adjust to the new environment and new people. But you could adapt to the new situation and new place. All these examples focus on our ability to adapt to change. Lack of adaptation may result in stressful experience. McEwen states that the allostatic systems in our body help us to adapt to change. Thus we have the flight or fight response, and the tend and befriend response of the body that enables to cope with the stresses. In fight or flight response, the person either takes up certain actions to deal with the stressor, fight, or avoids and escapes from the stress situations, flight response. In tend and befriend response, the person displays tending or caring behavior and seeks social support, which helps to reduce the stress. Tailor it. AL suggests that the fight or flight response to stressful situations is engaged more by men, whereas women show more tend and befriend response to stressors. When stressors are intense in nature, more frequent, and of longer duration, it increases the stress level of the individual and may lead to various psychopathologies, for example, depression, anxiety disorders, eating disorders or substance use. It can also lead to physical health problems. Experience of trauma may lead to psychological disorders such as post-traumatic stress disorder, PTSD. However, experience of stressors may not always lead to psychological disorders, as it depends on a dynamic interaction between the stressors, the individual psychological factors, and the environmental factors. The diathesis stress model explains that the genetic disposition interacts with the psychological, socio-cultural and contextual factors to determine the outcome to stressors. 12.4 Trauma, Meaning and Origin. Trauma is defined as an emotional response to a terrible event like an accident, rape, natural disaster, etc. APA, American Psychological Association. It is a deeply distressing or disturbing psychological and emotional response to a traumatic event or experience. The individual experiences shock and denial. The trauma affects the individual's functioning in all aspects of life and has a long-term effect. There are three main types of trauma. Acute trauma results from a single incident. Chronic trauma is repeated and prolonged, such as domestic violence or abuse. Complex trauma is exposure to varied and multiple traumatic events, often of an invasive, interpersonal nature. The origin of stress and trauma can be in the following stages. Trauma during womb stage. The fetus in the womb starts sensory development from the 12 weeks or third month of pregnancy. Various psychological and physiological conditions during this stage affect its development, which can have lifelong impact on the psychosocial journey of a human being. Mother's physical health condition, nutrition, injuries, medical illness, etc. affect the development of the fetus. Mother's mental health status / condition, home environment, family interaction, marital relationship / conflicts, etc. have potential to affect mother's emotional and psychological well-being and in turn impact the fetus development. Premature birth and complications during childbirth are also major factors that can impact human psychological development and influence their personality development, maturity, crisis management capacity, and psychosocial emotional development. Trauma during developmental phases. Human lifespan is divided into various stages and has different characteristics at each stage. Human development is conceptualized differently by theorists, who also talk about factors that may cause disturbances in development and lead to maladjustment and mental health problems. According to Erikson's theory of human development, different stages of life have their own developmental goals. Inability to achieve these goals results in crisis and affects negatively development of the individual. For instance, adolescence stage aims to achieve the goal of establishing an identity. Failure to do so results in identity crisis. This creates stress in the individual. If the individual is not able to adapt and cope with the stressful experience, it may lead to mental health-related problems and mental disorders depending on the severity of the stresses. Sigmund Freud has proposed 5 stages in child development, each stage characterized by different types of conflicts/trauma. Resolution of these conflicts in each stage gives rise to a healthy, balanced personality and smooth transition to the next stage of development. However, unresolved conflicts/trauma at any stage of development can lead to different type of psychological problems in later life of an individual. According to Freud's theory of psychopathology, every psychological disorder has a root in an unresolved trauma/conflict during the earlier developmental stage. Though this was highly criticized later by other researchers, but still it is relevant in understanding childhood trauma/conflicts and their role in development of psychopathology. The 5 stages of development given by Freud are briefly described as follows. Oral stage, 0-1 YR. It is characterized by getting pleasure through sucking. Careful disposition of this phase helps develop positive personality traits like trust for others, self-reliance, self-trust, and sharing. On the other hand, crisis disposition during this phase develops pathological traits like dependent, demanding, envy/jealous, pessimism or excessive optimism, and selfishness. Developmental delays, especially cognitive and language delays and reactive attachment disorder, are also observed due to imbalanced disposition of this age. Anal stage, 1-3 years. This developmental phase starts at the age of 1 year and continues till 3 years. This period is known as toilet training period. In this period, emotions like tender affection, shame, pride, guilt develops. Careful disposition with love and affection of this phase develops personality traits like confidence, independence, decisiveness, cooperation, whereas critical and high disciplinary training in this phase leads to pathological traits like ambivalence, stubbornness, messiness, frugality, rage, and in later stage in some persons it may develop obsessive-compulsive disorder. Phallic stage, 3-5 years. This developmental phase lies between 3 years to 5 years. In this age, child's interest develop for parent of opposite sex as well towards genitals. Boy takes their mother as love object and girl starts to mimic mother. In this age, emotions like guilt, envy, insecurity, humility, confidence develops. Careful disposition of this phase develops personality traits, i.e., emotional stability, creativity, constructive abilities, self-competency. On the other hand, individual develops pathological traits like excessive competitiveness, excessive ambitiousness, sense of shame, and inadequacy if the conflicts are not resolved. In adulthood, it may lead to different neurotic disorders and adjustment problems. Latency stage, 5-11 years. Latency period starts from 5 and ends at 11 years. In this developmental phase, child develops superego, moral and ethical values. Child learns to receive and follow systematic instructions, and steps towards social responsiveness. This stage needs to channelize the energies of the child. They also learn impulse control and ego balance, as well as skill development. Careful disposition of this stage develops personality traits like sense of industry, sense of initiative, decision-making, socialization, in the absence of which individual develops pathological traits like poor impulse control. It may be over-control or under-control, which in either way hampers the personality development, and in later stage it may develop psychological and adjustment problems. Genital stage, 11-19 years. This is from 11 years to 19 years. This is the puberty period when biological development, change in body shape, hormonal changes and secretion, takes place and one progresses towards adulthood. It is the final stage of psychosexual development of human. This is the stage of onset of reflection of conflict developed in previous stages and mature sense of identity, independence, social expectations and cultural values develop. Careful disposition of this stage develops personality traits like maturity, creativeness, ego balance, productivity, meaningful goal setting, values of life and self-worth and realization, sense of meaningful participation in areas of work and love. Pathological traits like identity diffusion, gender identity problems, gendered role confusions etc. may occur if the conflicts are not resolved properly. Exaggeration of complexes / conflicts arose in previous stages may also occur, leading to various problems. Personality dispositions also develop during this stage. An individual becomes extrovert or introvert, adjusted or maladjusted, based on the resolutions in different ways. So in the light of different developmental phases, it is clear that imbalanced disposition of any developmental phase determines the person's personality traits and develops some behavioral / neurotic problems like temper tantrums, attention-seeking behavior, aggression, sibling rivalry, separation anxiety, lying, stealing, fear of school, disrespectful behavior, maladjustment, selfishness, accusing others, violent behavior, different fears and phobias. It determines person's stress / trauma tolerance capacity as well his behavior during a stressful / traumatic situation. Life situations and circumstances. Life situations and circumstances can work as triggering factor for stress at any stage of life, like change in job / residence / school / place, trouble with boss / seniors / teachers / head of family / spouse, change in financial status, especially from higher to lower, one's own or family members' severe illness / injury / accident. Further, breakup in a romantic relationship, separation or divorce, death of close family member / spouse / friend etc. may be the significant life events which might result into stress. Besides these, natural disasters, flood, earthquake, etc., man-made disasters like terrorism, other disaster like fire, collapse of building, plane or train crash etc. also cause long-lasting trauma in life. In other words, any sudden unexpected incident which affects a person's psychosocial emotional life in threatening or negative manner causes stress or trauma. Thus various physical and psychosocial factors can work as precipitating factors for severe stress or trauma, such as disability or disabling illnesses, social pressures, family pressures in the form of interfamilial or intrafamilial factors, or any other unavoidable circumstances. The physiological mechanisms involved in stress and trauma are quite elaborate. Our stress response is our body's response to danger. It aims to protect us from any imminent stimuli perceived to be dangerous to the self. Our body has a very comprehensive and interlinked system that helps it prepare to deal with the emergent situation and then restore the energies used later on. There are two pathways used by the brain that influences the physiological mechanisms when we are faced by a threat or challenging situation. The first is the autonomic nervous system, ANS, which consists of sympathetic nervous system, activated in threatening situations, and parasympathetic nervous system, activated under resting situation. The second is the hypothalamus pituitary adrenal pathway or HPA axis. Studies indicate that underactivity or overactivity in the HPA axis is related to various psychopathologies such as anxiety, depression, autism, and schizophrenia. 12.5 Stress, trauma and psychological disorders. Trauma and stressor-related disorders are a group of emotional and behavioral problems that may result from traumatic and stressful experiences such as exposure to physical or emotional violence or pain, including abuse, neglect, family conflict, etc. What happens when trauma is triggered? There is numbness, confusion, exhaustion, sadness, anxiety, agitation, dissociation, physical arousal, and blunted affect. Most responses are normal in that they affect most survivors and are socially acceptable, psychologically effective, and self-limited. However, when these are long-lasting and negatively impact the daily functioning and interaction of the person, it leads to psychological disorders, especially stress and trauma-related disorders. The key features of the trauma and stressor-related disorders are the intrusive memories of the traumatic event, which include a. Recurrent, unwanted distressing memories of the traumatic event, b. Reliving the traumatic event as if it were happening again, flashbacks, c. Upsetting dreams or nightmares about the traumatic event, and d. Severe emotional distress or physical reactions to anything that reminds one of the traumatic event. Physical sign related to trauma can leave a long-lasting effect as compared to the short-lasting symptoms in stress conditions. These physical symptoms may include knee and joint pain, high blood pressure, diabetes, cardiac conditions, disturbed sleep, irregular menstruation cycle or increased flow during menstruation, irregular bowel syndrome, digestive system problem, etc. Psychological sign and symptoms of trauma include intense disturbing thoughts, re-experiencing trauma through flashback, repeated thoughts, nightmares, persistent feelings of fear, sadness, anger, aloofness /detachment, uncontrolled impulse, strong negative reaction to ordinary things like loud noise, sparkling lights, excessive substance abuse, anxiety, depression, obsession, etc. Intensity of psychological sign and symptoms varies from person to person and depends on various factors such as personality, attitude, presence or history of mental / physical illness. Psychological symptoms of trauma may increase due to presence of psychopathology or may convert in psychopathology due to traumatic experience. Vinita has witnessed years of domestic violence between her parents. One day when two teachers in her school got into a high-pitched verbal argument, Vinita started shaking, her heart started beating rapidly, and she was having difficulty in breathing. Vinita is most likely experiencing a panic attack / immense anxiety, which is a common behavioral consequence of trauma. DSM-5 lists 3 significant trauma and stress-related disorders, namely, adjustment disorders, acute stress disorder, and post-traumatic stress disorder, PTSD. A common feature of these disorders is the stress experienced by the individual, that is, there is the presence of a distressing experience. But they differ in terms of the severity of stress, nature of symptoms, duration and intensity of symptoms, and impact on daily life functioning. 12.5.1 Adjustment disorders. Day-to-day activities and functioning require human beings to adjust to a variety of people and situations. The stresses that arise in these contexts create disturbance and distress in the individual, but they are not traumatic in nature. Most people can adjust to these stresses. However, when our reactions to these daily life stresses are out of proportion to the severity of these, it is considered as an adjustment disorder. It affects different aspects of individual functioning such as personal, social and work performance. Here the nature of stresses is not severe and there are no specific symptoms. The diagnosis usually happens within 3 months of occurrence of the stressor and the reactions last up to 6 months only. 12.5.2 Acute stress disorder. Acute stress disorder, in contrast to adjustment disorder, requires specific symptoms for diagnosis and occurs in response to traumatic events. However, similar to adjustment disorder, it is a short-term reaction to traumatic events that may last from 3 days to 1 month. Thus acute stress disorder occurs in reaction to stresses that are sudden in nature and the reactions last for a shorter period of time. The traumatic stresses can include accidents, disasters both natural and man-made, abuse, rape, violence, war, terrorism etc. 12.5.3 Post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, is the most intense one with severe stress experience after a traumatic event. Like acute stress disorder, the diagnosis of PTSD requires specific symptoms, however, they last longer than 6 months. It includes the following 5 main clinical symptoms: exposure to severe stress leading to aversive experiences. Intrusions related to the traumatic event occurs through flashback of the trauma experience, nightmares, distressing memories related to the event, and distressing physiological reactions while remembering the event. Avoiding any stimuli, for instance people, places, objects etc. that remind the traumatic event. Increased arousal and reactivity such as angry outbursts, irritability, being extreme sensitive and vigilant, easily startled, reckless behavior, disturbances in sleep, and problems with concentration. Alterations in cognition and mood leads to inability to remember important aspects of the traumatic event, negative thoughts and feelings leading to ongoing and distorted beliefs about oneself or others. For example, I am bad, no one can be trusted. Distorted thoughts about the cause or consequences of the event leading to wrongly blaming self or other, ongoing fear, horror, anger, guilt or shame, much less interest in activities previously enjoyed, feeling detached or estranged from others, or being unable to experience positive emotions, avoidance of happiness or satisfaction. PTSD results from an experienced threat that produces intense fear, helplessness, or horror. However, not all traumatic experiences result in post-traumatic stress disorder. Factors that may increase the likelihood of PTSD include experiencing intense or long-lasting trauma, having experienced other trauma earlier in life, such as childhood abuse, having a job that increases your risk of being exposed to traumatic events, such as military personnel and first responders, having other mental health problems, such as anxiety or depression, having problems with substance misuse, such as excess drinking or drug use, lacking a good support system of family and friends, having family history of mental health problems, including anxiety or depression. A young girl of 17 years reported to a clinic with the problems of having interpersonal and trust issues, especially when talking to boys. She appeared to be hypervigilant, cannot tolerate even slightest of touch, was fearful of going alone and of dark places. Mother reported that she cannot sleep alone in a room and have frequent nightmares. Detailed interview and psychological assessment carried by a mental health professional revealed that she was sexually abused when she was a child of 5 to 6 years by a close relative, and she could not reveal it to anyone in the family. This is an example of post-traumatic stress disorder. 12.6 Management of stress and trauma-related disorders. Since stress is a most common experience of life, management of it needs to focus on knowing about the nature of stress, building inner psychological resources that enable one to deal with stress effectively, and understanding the mind-body connection in determining our stress experiences. It is not possible to avoid stressors in life, but for keeping oneself fit, one should practice various methods to manage stress, such as developing self-awareness, learning about effective coping resources, acquiring emotion regulation skills, engaging in relaxation exercises. One of the effective techniques used for dealing with stress is the stress inoculation training. Like we inoculate ourselves against infections and diseases, this technique helps us to inoculate ourselves against stress. Developed by Donald Meekenbaum, stress inoculation technique is a therapeutic intervention that can be given to people at risk for stress. It prepares them for stressful circumstances and events, and help them deal with stress-inducing situations with minimal distress. It has 3 phases. A. Conceptualization involves identifying and clarifying the nature of the person's stress and educating them about the nature and effects of stress, and how stress inoculation works. B. Skills acquisition. Here the person learns a series of skills for dealing with stressful situations. And C. Rehearsal and application. Here the person puts into practice what they have learned. Stress inoculation technique is often used in conjunction with other cognitive behavioral therapies and techniques. Some tips for developing emotional well-being to manage stress. Sit in a calm and quiet space, close your eyes and introspect. Introspect your day activities, a particular event, your actions and reactions. Give message to yourself by speaking loudly: what I cannot change, people around me, my circumstances, my situation, environment; what I can change, myself. Accept the circumstances, environment and people around you and yourself as it is. Don't try to change, try to highlight the positive points in the above mentioned. Develop the attitude of gratitude. Develop forgiveness. Forgiveness does not mean to forget, rather learn a lesson and move on. Make positive affirmations and speak them daily 3 times a day. Be altruistic and contribute to others' well-being. Management of trauma and PTSD. Although drug treatments are used for PTSD, the most effective line of treatment for PTSD involves psychotherapies. The main focus of the treatment is to help the person to process the memories of the trauma so that catharsis is achieved and acceptance is developed. Debriefing. Debriefing is a set of procedures, technique, that provide emotional and psychological support to the person immediately after experiencing a traumatic event. The person is encouraged to narrate the traumatic events in a supportive environment. The main goal of debriefing is to prevent post-traumatic stress disorder and other negative consequences. Cognitive behavior therapy. The main focus of the cognitive behavior therapy is to identify the unhelpful cognitions or thoughts, question their validity and usefulness, create alternate helpful thoughts, and practice these through behavior change. It involves various cognitive and behavioral techniques to modify the negative or faulty cognitions and replace them with positive and realistic thoughts. Thus there is identification of the negative automatic thoughts of the person, reality testing of these thoughts, adoption of new helpful thoughts, and monitoring the implementation of these modified thoughts. It involves homework assignment, activity scheduling and behavioral rehearsal to actually practice these newly learned helpful cognitions. Eye movement desensitization and reprocessing. Eye movement desensitization and reprocessing, EMDR, is a form of psychotherapy in which the person being treated is asked to recall the distressing or traumatic memories. The therapist then directs the patient in one type of bilateral stimulation, such as side-to-side eye movement or tapping either side of the body. This therapy developed by Shapiro is based on the idea that negative thoughts, feelings and behaviors are the result of unprocessed memories. This process helps the person to process the traumatic memories. Supportive therapy. Person affected by trauma needs family and social support. Supportive psychotherapy aims at providing the necessary psychosocial support to the individual. It uses warmth, friendly and supportive manner without evoking undue shame or dependency. Body language and communication skills, both verbal and nonverbal, of the therapist play a major role in helping the patient release their intense traumatic emotions. Relaxation techniques. Various muscular relaxation techniques, deep breathing, breathing exercises are powerful tools to treat PTSD. Some methods of relaxation techniques are Jacobson Progressive Muscular Relaxation, JPMR. This is based on the mind-body connection. Dr. Edmund in 1920 observed that relaxing the muscles could relax the mind as well. He applied the JPMR technique on his patients suffering from anxiety. The technique involves tightening one particular muscle group and then releasing the tension. The same is repeated with each and every muscle group in a sequential way. This helps you to gradually relax the whole body. Yoga and meditation. Different yoga techniques including yoga breathing exercises of pranayama, deep breathing, yoga nidra, guided meditation can help one to relax whole body and mind. 12.7 Let us sum up. In the present unit, you learned about a ubiquitous phenomenon of stress in our life. The concept of stress was explained with a focus on its signs and symptoms, and types. Trauma indicates the severity of stress and may lead to different stress-related disorders including post-traumatic stress disorder. The categories of stress-related disorders as included in DSM-5 were described including the post-traumatic stress disorder. Finally, management of stress and post-traumatic stress disorder was described.